Okay, so we just got through harvesting the donor on Adrien's surgery. We did a Max Harvest Plus hair transplant, and we were able to extract approximately 80 square centimeters of tissue. So if you take a look here, you'll see the amount of strips we have here. We have 6 separate strips, each in approximately 40 centimeters in length, yielding about 80 centimeters. This is a foot right here, okay? So what's so important is, if anyone watches my videos, is to look at the level of transection as far as how the grafts are cut and if there's any transection of the follicles. And as you can see, I consistently got 6 gorgeous strips, which is going to yield this patient a lot of hair. You're talking, I'll lowball the numbers and say he has about 15,000 hairs here on this particular case. So it was an excellent harvest. And we keep these grafts, when they're out like this, people don't realize, but we're constantly hydrating them. They don't sit out on our table long. This is just for the camera, and that's why it's wet in the background, because we're constantly hydrating the strips just to show the camera now. Anything you want to add?
Well, yeah, what I would like to know, Dr. Bolton, is compared to what Adrien had before, he had a follicular unit extraction surgery. I believe it took 12 to 14 hours.
Yes.
Show me the representation of what he got on that FUE, the equivalent of hairs.
Okay, the equivalent of hairs would be on this one piece here, from here to here, tops.
How many hairs is that?
Let's say 1,500 hairs.
He got about 1,500 hairs
Tops.
on his FUE.
Tops.
And how many of them actually grew on his head?
Not many.
If you had to guess.
Very low yield, probably 7,500 hairs.
He had
750 hairs, excuse me. 750 hairs.
Okay, so they yielded 1,500 worth of tissue, meaning there's those holes in the back of his head,
Yes.
1,500
He
holes.
yielded about 1,500 follicular units.
Yeah.
And he got probably, what grew was probably about 750 to 1,000 hairs.
Okay, so now he has how many sitting there?
This is approximately about 80 centimeters. And if it was perfect grafts, it'd be about 16,000 hairs, but because he had the follicular unit extraction, there's some areas with holes, so I'm going to lowball it and say about 15,000 hairs.
Okay, so he got 15,000 hairs.
Yes.
Compared to his last procedure where he got about 1,500 hairs.
At best.
Of which only half of those grew.
Right, correct.
So he didn't even get 10% of what you got today.
Correct.
And he sat in a chair for 12 hours.
Correct.
They decimated his donor.
Correct.
Okay, and this, after all this, will only have one scar, right?
You have one scar, which will be better than what you have with this.
Maybe we can take a look at that.
Yeah,
and
I'll show you that one's clean.
Yep, he's got one scar. And this took you how long to excise?
Half hour, tops.
30 minutes.
Tops.
Okay, and how long will it take your staff to dissect that tissue?
About 2 hours, tops.
Okay, and he'll be done.
Places another 2.5 hours.
So, okay, so this whole procedure will be less than 6 hours from start to
6 hours
finish.
from start to finish.
For 15,000 hairs.
Yes.
Awesome.
Excellent.
Why would anyone do an FUE?
I don't think they should.
Does the results correspond to how many hairs you get, generally speaking?
Of course.
So if I get 10,000 to 15,000 hairs, I'll always do better than someone who gets 1,000 to 3,000 hairs?
Simple math.
How come people don't see it that way?
They're afraid of the scar.
Oh, they don't like that one scar in the back.
They're afraid of the scar, but you'll talk to my patient after, and you'll see the difference of an FUE versus a linear strip.
So people think the FUE is a better scar, even though they get the buckshot look in the back. Correct. Thousands of dots.
That's what they believe.
They think that's better.
They're misled by the internet. The internet's misleading them.
But they'll find it out when they go back for their second procedure and they can't get much hair.
Correct.
Right. Whereas we could do another procedure and get a lot of hair again without scars.
Correct.
Yeah. Okay. They just do a lot of good marketing till the people figure it out.
That's right. So take one last look, because I got to put this in water. And then, por favor.
A lot of hair?
Mucho
I think a lot of people would be very jealous and look long and hard to try and find a doctor who could get someone that much hairs in one shot. Half a day.
Okay, so we just got through harvesting Adrien's donor. I just fit all the anesthesias in, and we made all the initial sites where the grafts are going to go. How are you feeling?
Super great.
How does this compare to your FUE procedure?
Super different. The FUE is super tedious. Right now is very nice.
So was there more pain with the FUE?
More pain.
With the FUE. Okay. So this was easier.
Super easy.
Okay, excellent. So we did the Max Harvest Plus hair transplant. We were able to get Adrien about 80 square centimeters of hair. So I was able to fill his entire area. You can see the initial slits. These are where we put the tiny little one hair grafts all the way around the front. We build behind that with the follicular units behind that. And then we put those multiple follicular grafts all the way through the center and into the crown. So if you look back here, you'll see we have the pattern made out for we're going to fill his entire head from front to back. The suture line closed beautifully. You can see it on the sides here. The beautiful closure. He had excellent elasticity. He's been a great patient. Everything's going perfect. So far we've been in the OR approximately maybe about 2.5, 3 hours tops, and everything's just going perfect. Is there anything you'd like to say to the camera?
Yes, remember, when you are a great patient, great result.
Excellent. Hi there, here we are with our patient Adrien. Adrien's here for a 3-day follow-up post-op visit. We did his surgery on Friday and today is Monday. How was your weekend? How did everything go?
Great, amazing, yeah, really amazing.
Did you have any pain over the weekend?
Nothing.
No pain?
No pain.
I don't see any swelling?
You see?
Nothing. So you've been just resting, taking it easy, letting...
All the time rest.
Okay,
Very
excellent.
important.
Excellent. I'm going to just kind of show the camera his suture line. So when we do that Max Harvest Plus hair transplant procedure, we take him the entire way around. As you can see how nice and clean that looks. We did his entire head from front to back, where we grafted the entire area. Huge case. I mean, you can just see the size of his bald area was enormous. And so what we did is we went through and just completely took him from front to back and filled them in. He had a previous FUE where you could almost see the little holes from his previous surgery. And I still to this day can't understand why anybody's doing the FUE because you can't get any hair. We're able to get so much more hair from that strip, and once this heals, this will be undetectable. The hair is going to cover up on top. You'll never be able to see it. And everyone's talking about the FUE, how great it is if you shave your head. Well, it's not great. You can just see all the little holes. So I don't see the benefit of doing it when you get so little hair. So at 3 days, if you look at, and I'm just going to kind of tuck your chin down a little bit, you can see the entire area was filled from front to back. With an FUE, he might have only got, the very one little section, but instead we were able to cover the entire top. How did this experience compare to the FUE?
Wow, my experience super different. The FUE, for me, no result. My area is huge. The FUE, no result. You have density, tissue, suture, 100%.
So what he's saying is you get much more hair from a linear suture line versus an FUE. And he said he had very little to no results from his FUE procedure. And on top of that, they destroyed his donor. Josh, anything you'd like to add to that?
You mentioned 80 centimeters squared of tissue was taken.
Yes.
How many hairs does that translate to?
About 16,000 hairs.
16,000 hairs.
Wow.
And what's the top capability for an FUE doctor to get? If they stay in the donor.
It took him 2 days to get 3,000 hairs.
And how many grew of his 3,000?
Probably 1,500.
1,500 hairs versus 16.
1,000.
Yeah.
Yeah. And 5 hours versus 2 days.
Yeah.
So that's what we see. And it just doesn't make sense why people are doing that FUE to this day. I don't get it.
My face is different right now. It's happy. Yeah.
You know what's going to happen.
Wow.
And you've seen it a million times working with Dr. Bolton.
Yeah. Doctor, I appreciate it all the time, all my life.
Congratulations, buddy.
So there's a guy on the front lines, Adrien, working every day with Dr. Bolton, who we almost had the feeling didn't care too much about whether he had hair or not until he started seeing all the results of all the difficult patients coming in with incredible results. Why wouldn't he want that too for himself? So we're really looking forward to seeing a great result very shortly.
Yeah.
Hello there, here we are with our patient Adrien. Adrien is here for a 3-month follow-up visit. We did a Max Harvest Plus hair transplant procedure 3 months ago from the day. It was one of the biggest cases that we did. We moved about 80 square centimeters of hair. He was a complete class 7. He had a previous FUE where his donor was basically depleted, and we were still able to get a very large harvest for him. How are you?
Good. I'm
Good.
feeling good, great. Yeah.
How do you like what's happening so far?
So far, super different. Yeah, really.
Has it changed your life? Just
Complete. My life is complete, everything. Yeah.
okay. Now you went home to Cuba recently
My friend, my family is wow.
in 3 months.
Yeah.
So in 3 months they can't even believe what's happened here. Imagine what happens in a year. So this is just the very early stages of growth. We completely recreated the hairline. I'm going to have you just kind of tilt your head down a little bit. Fill them all the way in. As you can see, he's already filling in throughout the top. That's great growth for 3 months. I'm going to turn you to the side here. You can see the suture line is already almost undetectable at the 3-month point. You can see the whole way around how that suture line looks. This is basically already hidden. Before you could see all his FUE holes. Now you can't even see where the suture line was. This is going to continue to improve over the following months. I'm going to tilt your head back. As you can see, the outline of the spiral coming in, the directions and angles are all coming out perfect. You can see the hairs filling in throughout the entire top. Just an excellent case. These little spots are ingrown hairs. This is one of the most common things we see throughout the healing process. As the little transplanted hairs are trying to make their way through, in many cases they'll get caught underneath the surface of the graft and they might get a little scab. Best thing to do is to leave them alone and they go away. If they do decide to pop it like a pimple, that's okay. It's not a big deal as long as you clean it up after and before. And then as you can see the whole way around, how the suture line's almost undetectable on the side. And this is just going to continue to improve over literally the next year. He's going to see improvements. When we do a big case, it takes almost 18 months to get a final result. So he's 3 months into an 18-month result, and this is already where he's at. So he's going to see some amazing improvements in the time to come. Josh, is there anything that you'd like to say to this?
No, it looks great. I think he's off to a great start. 3 months, 90 days. We, as a matter of rule, will tell people don't expect anything for 3-4 months. Just beginning results. Usually the hairs are dormant for the first 3-4 months. So
Exactly.
he's going to be a superstar result.
Yeah,
No question.
And I completely agree with what Josh said. In many cases, some of the hairs won't even start to grow for about 6 months. So he's going to continue to see new hairs coming out and growing, and it'll just continue to improve. Anything you want to say to people thinking about this?
I'm feeling great, really. Yeah. My life is everything changed.
Excellent. Well, congratulations, buddy. We'll look forward to following up with you soon. Hi there. Here we are with our patient Adrien. Adrien is here for a 5.5-month follow-up. We did a Max Harvest Plus hair transplant procedure, but we happened to do a monster size case. We moved 80 square centimeters of hair. To put that into perspective, that's about 16,000 hairs with average density. This is more than anybody is doing anywhere in the world by far. The average follicular unit case on their best day might give you 4,000, 5,000 hairs. This is 16,000 to put that in perspective for everybody. It's just a huge case. So we took a class 6 patient from front to back, filled him in all the way. So completely did his whole head in one procedure. And we left him with no visible scar, which we're going to show you in a second. So if you look at it up close, you can already see the complete reframing of the face, how it completely looks natural. I'm going to show you the scar momentarily. How are you, my friend?
I'm happy, really happy. My life is, everything changed, really.
So you went to Cuba, right? What did your family think?
My travel to Cuba, my family is, wow, you look like different.
So
you're different person.
It's amazing. Your transformation is amazing. And he's only at 5.5 months. So we have another solid year of growth. So I'm just going to show your suture line. So face towards me, please. Yep, excellent. So with other procedures, everyone's so concerned about scarring. Well, he actually had a previous procedure with the follicular units, which they say is a scarless procedure. He had that, and he had no result, 0 result. We did a Max Harvest Plus with a linear scar, and let's show everyone this scar that everyone's so freaked out about. This is the scar. That's the scar, right through there, if you can see that. That's the scar. So I'm going to just kind of turn you a little bit. The scar is right there, okay? You can even see his old FUE holes, and here's the back of his head. In the meantime, you can see the spiral we built. You can see how this is starting to come in. This is going to continue to grow, and as he grows out, this will even fill in more. Now remember, this is only 5.5 months. And let me show this side. And so I'm going to just turn you. And so here's the rest of the suture line. Let's see if I can find it for you. There it is. Okay, right here. So this is it. You see it? That's the suture line. Right there. You can barely even see it. Just a beautiful, beautiful suture line. I mean, and he wears his hair super short, and it just looks perfect. So I just really want to emphasize the size of this case and the size of his loss. He was a complete class 6 with 0 hair on the top of his head, and in one procedure, 5.5 months later, he looks like this with that scar. And that scar is not done healing, and this is not done growing. So we're very excited to show everybody this. Now, Josh, would you like to add to that?
I think you did a great job. You have your before picture on your phone, Adrien?
Yeah.
Yeah, maybe we could put that up there. At the same time, we'll add that later. But basically, the idea is that the difference between what we do here and everybody else is probably 4 times the amount of hair.
Yeah.
4 times the coverage, 4 times the result. A lot of people don't realize this is all math. If he's lost 40,000 hairs and he got back 16,000, you're always going to do better with Dr. Bolton than you're going to be choosing another doctor who gives you 3, 4, 5, 6,000 hairs.
Yeah.
Congratulations, buddy.
Right now, using the brush, using the mirror. Before in my life, never. And that's it. Right now, brush. It's different. My life has changed.
Awesome, man.
Thank you.
Congratulations. Hi there. Here we are with our patient Adrien. Adrien's here for a 1-year follow-up after a Max Harvest Plus procedure. We did one of the biggest procedures we've ever done on Adrien. We moved about 80 square centimeters of hair, which is about 16,000 hairs. Crazy amount, unheard of. He was what's called a class 6, class 7, which means he was totally bald. He had a previous surgery that they did an FUE, and he had very limited results. And it also affected his donor region because when they do the FUE, it affects the donor tissue. He came in nervous because of the FUE. He had a bad experience. So the day of his procedure, he was apprehensive. And so you were nervous that day.
Yes, very nervous.
How did it go though? Did you have pain?
No, nothing.
So no need to be nervous.
Nothing.
Nothing.
Easy.
Oh, okay.
All the time.
And how are your results? Are you happy?
Of course, my face is fresh right now.
So you feel more confident?
Of course, yes.
Excellent. Okay. So when we did that case, we completely restored his hairline the entire way across. Just gonna kind of spin around here and show the camera how this looks. Huge case. He's not even fully done growing. He's only at about 12 months. These big cases take upwards to about 18 months to grow. And so you can see it still, has some room to fill in. It's a one procedure result. And then I'm gonna spin this way. Good. And you can see how it completely reframed his face. Looks nice and natural all the way around. If you were to come back for a second procedure, which we're probably going to do at the 18-month point or so, we're going to do what's called the density case, where we just kind of go through and fill in the hairline and then just sticking it up down the center with density and fill it all in. But anyways, what's important about this case is the amount of hair removed and getting this type of result on that much loss in a single session. No one in the world is doing that. It's extraordinary. Very unbelievable that we were able to do that. And so what would you say? What do you tell someone else?
Come back this office. The Bolton.
Excellent.
Change the life.
Excellent. Congratulations.
Thank you so much. Start 10 months ago, in my life changed. My friend, my family is wow. Your faces change everything.
There's nothing more than we love than when our patients come back with their head held high and their shoulders up and excited to show us what we did for them.